Hello, my name is Paul Gammie. I'm the owner and general manager of Gammie Homecare. We've been a provider of home medical equipment services on the islands of Maui and Kauai in Hawaii. On Maui since 1986 and on Kauai since 1999. I've been in this business for over 30 years. I am speaking to you today because of the change in the policies related to the Medicare program that is going to greatly affect not only the community that I live in and the communities that we represent as a company, but all across the United States. Many rural areas will be greatly hurt by what Medicare has done related to people getting products and services that they need to have their tools to stay at home. We call it home medical equipment. Other people call it their tools of life. The purpose of this goal is to educate people. The purpose of this goal is to try and inform people why things are happening and why changes are coming. I do not expect that it will change anything in the immediate or near future, but unless we have discussions about what's happening and a debate about whether this makes sense, nothing will change. What's happened is Medicare has decided that home medical equipment dealers, without basis of any negotiation with any of the rural providers, has decided that we are so grossly overpaid for our services and our products. In 2016, they have cut our reimbursement rates by over 50%. That's 50%, and expect that there'll be no changes in the levels of service or products. This company has run for the last 5 years on a 5% profit margin. There is no way that I can have a 50% reduction in the provision of pricing for the products that we supply and have things still remain the same. This is true for all rural areas in the United States. The percentage will vary a little bit from one to the other, but for everybody it's over 50% for the great majority of the products. Some products are as high as 80% off. This is after the government has become extremely aggressive in auditing every little detail of paperwork that we submit to them. Between the audits and the price reductions, this company took the policy as of April 1st, 2016, that we could no longer work with the Medicare program. We are the only providers of certain services on the islands of Maui and Kauai. We're the only providers of power mobility devices. We are the primary providers of many other goods and services. By us not being able to help our friends and fellow citizens under the Medicare program, it's creating great hardship. There will be a backup in the local hospitals trying to get people home. There already are a lot of people that are angry, frustrated, and greatly concerned why their loved ones can't get the products and services they need to keep them at home. The government has decided that it's not a problem, that they'll just take care of it and we can all just go on our happy way. I call it magic math. The magic math of the government is not working and cannot work. There is not a single provider that has stepped forward in the two communities that I represent and said that they can do it for the numbers that are provided for by the government. I would happily turn over all jobs to any new provider. I challenge anybody that sees this video to come in, look at the numbers of what it costs to do business in Hawaii, and see how you could possibly do it for what is being required of us at this time. We have managed to have discussions with other health plans and convince them of the error of their ways, that if they try and follow these numbers, that the status quo can be maintained. It cannot. So other health plans have come to the table and have been willing to give us fair negotiations, and with those companies we still work with them. The others that are insisting on following these Medicare numbers that were again gathered without the benefit of negotiation with any rural providers, they have a program that they've used through the local urban area, which is our local urban area is Honolulu. And there's many flaws with the program that is in place in Honolulu. Those flaws have now come to the outer islands in spades. All rural providers throughout the United States are having the same problem. And I apologize to all of my friends and my community members out there that we have to say no to. And yet, it's like if you were to go to any service in a competitive market environment of which we stand, and try and say that you can take 50% of the money away from that service provider and still believe that you can maintain a service level, then that is not a true marketplace, and that is not what the reality of our marketplace is. And in fact, I would challenge any person to come in and examine what we have to do to work already with the government. This is why there's been no new durable medical equipment providers open in the outer islands of Hawaii, to my knowledge, in the last 10 years. It's already such a difficult job to do, and a difficult way to provide services because of the great amount of rules and regulations that we have to work under. We have many different levels of costs that are required to support the services that we do locally, yet people will go on the internet and pretend that the internet pricing can be done automatically and forget that there's local costs of electricity, insurance, accreditation, labor, delivery costs. We have the highest costs of gasoline in the country. It's a series of costs that are totally ignored by the government. They just want to have internet pricing, and they give us a list of 32 supplier standards that we have to adhere to be a Medicare provider, and yet they pretend that it doesn't cost anything to do any of these costly standards and get them fulfilled. So I'm reaching out today to ask people to reach out to our government representatives, send letters of concern into the government. We have form letters that people can sign off on if they agree with them, that explain the situation and ask for a special consideration. What's going to happen is if this continues, people will get stuck in the hospitals, which is the highest level of cost of care available to any of our citizens, and the most efficient, the most desirable method of taking care of people in their own homes, with their own loved ones, give them the tools so that they can take care of themselves, is being ignored. The right hand is not aware of what the left hand is doing, and this is creating a disaster. So if you are willing to stand up and become educated about this system, please contact me. I can be reached at, our mailing address is 292 Alamaha Street, Kahului, Hawaii, 96732, or my email address is paulg, P-A-U-L-G, @gammie.com, that's Gammie.com, and I'd be happy to share any kind of information. And if we join together, we can turn this around. If nobody does anything, it's just going to get worse. Thank you for your time today.